Ladies and gentlemen, and my DiaBeat colleagues, good morning and welcome. Today, I am talking to you from India. Today is the 18th of October and it is a Friday. Our topic, the psychological aspects of diabetes. You know, friends, we have frequently heard in all our past webinars about nephropathy, neuropathy, retinopathy, and there can you hear me now?
Yes, doctor.
Good. And did you hear any of the previous portion that I spoke about?
Yes, sir.
You could. Well done. I don't know why it seemed that I got muted in between. Nevertheless, coming back to where I left off, you know, we know the connection between diabetes and nephropathy, neuropathy, retinopathy, and so on. And we've had several past webinars dealing with this subject. When we decided to talk about the psychological aspects of diabetes, in my mind, new territory. So I began to read up about the correlation, if any. And ladies and gentlemen, I can tell you that we are on a trailblazing path. In my reading, I discovered that, and you're not going to believe this, that 70% of diabetics have stress specifically related to their diabetes. I also noted that 40% of diabetics had depression related again to their situation, and about 20% had bouts of anxiety from time to time. Now, I don't know whether our esteemed faculty is going to agree with me that we are on the path to a new connection. And that connection is the psychological connection, the cause and effect connection between diabetes and stress and anxiety and depression. And there seems to be a relationship. I really don't know. I'm not an expert on the subject. But I can tell you this, ladies and gentlemen, today as our faculty, we have a star. Now, what do I mean by that? What I mean is that Dr. Savita, who is our faculty today, has filmed, and that is why I use the word star, has been associated with 26 TV programs on her subject stress and psychology in English and 13 episodes in NDTV in Hindi. So, while some of us may say a movie star, we certainly say a star speaker for today's program. Dr. Savita has authored 2 books. One book on health psychology and stress management, and the other on health counseling. And she frequently appears in newspapers and the Times of India. She writes for Be Positive. She's appeared in Femina, Deccan Chronicle, and our own College Times. Dr. Savita is a PhD in clinical psychology and trained in the University of Mumbai. She holds more than 3 decades of clinical practice and has set up the psychiatric department in Tata Steel, has set up the wellness division, the lifestyle management division in the Apollo hospitals, and is a faculty, a professor, a teacher in health and lifestyle management. Dr. Savita, in addition, frequently speaks at TMDC, XLRI, the Business School, IIM, the Confederation of Indian Industry, and has had the great honor of speaking in Harvard, that's Boston, Massachusetts, the United States of America. And therefore, friends, I am deeply grateful to our faculty for taking the time to talk to us today. Dr. Savita.
Thank you so much, Dr. Kennedy, for that star introduction. And after that star introduction, whatever you say, I will definitely agree with. So I have no doubts on that. Friends, I hope that I do justice to the topic that I have at hand, which is diabetes and stress. And to start off my session, a slide next, please. And to start off my session, I want to ask you a question right at the outset. Are you stressed? As you think about that answer, slide next, please. Thank you. As you think about the answer, let me tell you that our ancestors were stressed about survival. Our forefathers were stressed about survival. How were they going to be able to feed themselves, and would they be able to live to see the next sunrise? These were their major sources of stress. For us today, our stress is our job. Our stress is, am I getting enough sleep or not? Our stress could even be, am I looking fine on Instagram or not? So we have stress of varying kinds. But do we have stress? The answer is yes, we do have stress. The audience is here for a relevant reason: diabetes. So my second question would be, are you diabetic? And your answer is yes, I am diabetic. So there is a connection between stress and diabetes. And this session will talk about how that connection comes about, what that link is, and more importantly, can it be changed? Can it be reversed? That is more important. So as I start my session, I want to emphasize, as a psychologist, I want to reassure you and I want to emphasize that, friends, stress can be reversed. Diabetes can also be reversed. Type 2 diabetes can also be reversed. The stress can also be reversed. However, if there was an involuntary, unconscious, consistent work that went into creating that type 2 diabetes and that stress, then there will also need to be consistent effort in attempting to reverse it. The problem is that we start a journey of reversal, but we somewhere or the other self-sabotage. We somewhere or the other give up on that journey and give up on ourselves. However, if you can keep reminding yourselves, if you can keep on that journey, there is no reason why stress and diabetes, both stress and type 2 diabetes, both cannot be reversed. Let's talk for a moment about, where do you experience stress? So, you normally say, I'm stressed. Where is this stress sitting? Where is this stress being experienced? Is it your mind? Is it your body? What is experiencing stress? There could be many different things. For instance, you're tapping your fingers a little bit more while you're waiting for something to happen. You're tapping your foot for a speaker who is not speaking so interestingly to finish their talk. You are biting your nails, perhaps. You are pulling your hair while you're deep in concentration about a subject that you want to study. You are feeling dry in the throat and you desperately want to drink a little bit of water before you continue with whatever you are saying. All of these are stress. They're symptoms of stress. They're telling you that yes, there is stress in you and it needs to be dealt with, it needs to be managed. Friends, your body experiences stress, your mind experiences stress. It starts with a perception in your mind, and the mind sends signals to every part of your body to get ready and gear itself for action to deal with what it is that is causing you stress. Next, please. Next, please.
1 second, ma'am.
Right. There are three various bodily systems that get into action, that get triggered the moment your mind says that there is stress that I'm experiencing. But let's talk about the first, that is the autonomic nervous system. Now, imagine you are in a stressful situation. Imagine that for some reason I didn't show up today, and one of you were invited by Professor Kennedy and Dr. Wilco to give a talk on some factor of stress. How do you experience stress? How do you experience diabetes? How are you managing it? And the mic was suddenly in front of you. What would you be feeling right now? Perhaps you would be feeling some of the symptoms that are mentioned over here. Perhaps your hands would be trembling just a wee bit. Perhaps your throat would be feeling just a little bit dry. Perhaps your heart would be beating a little faster than usual. Perhaps your face could look a little flushed and red and also a little sweaty. Perhaps your palms would feel a little wet and clammy. Your stomach might feel a little hollow, churning a little bit maybe. And strangely, your muscles would feel very tense and tight. You would be breathing a little heavier, and you would need to breathe deeper and longer, perhaps. These are some of the symptoms that you will experience the next time you have stress and you will become aware of what is happening to me in this moment of stress. So the autonomic nervous system has kicked in. It is looking at a situation as being stressful. It is not distinguishing whether this is a mentally stressful situation or a physically stressful situation. And all these changes are being made. And after a while, when the management of stress starts, only then does the reverse happen, which is the parasympathetic nervous system comes into action. So friends, the body has its own way of triggering itself to manage a stressful situation. It also has its own way of triggering the reverse of changes to bring about a relaxation response also. Now, sometimes what happens in our daily lives is you experience stress, and then you get into a habit of experiencing stress, or rather responding to that stress with an arousal response. And the more you experience stress and get aroused in the face of that stress, the worse the situation is going to be, the more chronic your stress situation is going to be. Next, please. Remember, friends, the body has its own way of managing stress, but we have to allow the body to do its own work. If we start getting in the way, and then we will start making our stress a chronic stress situation. Here's some research for you to give a little thought to about what it is that is being researched around the world. And you will find that most of this research indicates that, yes, there is a correlation between stress and diabetes. However, friends, stress does not cause diabetes. It is important for you to understand that because you have stress does not mean that you are going to cause yourself diabetes. Do not burden with yourself with that thought. Stress is not a causative factor for disease, but it does come into a quick second, which means stress is a triggering factor. Stress is an aggravating factor. Stress could decide the timing of your diabetes. It may not cause you the diabetes, but when you have a huge amount of stress, you're struggling to deal with that stress. Now, this stress is becoming a little long term. It is happening for a longer period of time. You are beginning to suffer with that stress. The timing of your diabetes could be decided by your stress. So stress plays a number two role for sure, even while it may not play the number one role, which is causing you stress. The causative factor is not stress. There are many other factors that have already been spoken about by other speakers. I will not get into that. But stress is definitely an aggravating factor. And then in the recovery and reversal of diabetes type 2, stress plays a role over there as well, where you will struggle with the reversal unless and until you learn to manage the stress also. So while you may have read the first few paras, I want to draw your attention particularly to the last para in the research over here, that lowering your stress levels can help reverse diabetes and pre-diabetes, which means reversal is possible. You lower your stress, it will help you and aid you majorly in reversing your type 2 diabetes and pre-diabetes as well. The good news is that all these hormones that are leading to stress spikes and insulin receptor damage are not permanent. It can be reversed. Next, please. So what is the source of your stress? Is it work? Is it your personal life? Is it relationships, which is, I think, a common factor for anybody in any strata of society, in any profession? Is it the choices that you are making? Is it your decision making? Is it the food that you are eating? What is the source of your stress? And what I want to say is that while we should identify the source of stress so that we can start making plans to deal with that source of stress, as far as diabetes is concerned, wherever and whatever the source of your stress may be, if it is not being managed, if it is being suffered through for a long period of time, then that becomes an aggravating factor, triggering diabetes and many other ailments that we are not going to touch upon this time, but it becomes relevant. So I won't take time to talk about the source, but what I will tell you is the stress could come from any different source. But if it is not managed, then it will take you to the next level, which is becoming a trigger, aggravating factor, exacerbating factor, irritating factor when it comes to diabetes. Let's talk about the second point over here, and that's psychosoma. And in psychosoma, I'd like to ask you a few simple questions. First of all, what is psychosoma? Psychosomatic ailments are those ailments which are physical ailments, physiological ailments, but have a strong connection to the mind. So psycho and soma being body and psycho meaning mind, not the psycho that people loosely talk about, but psycho being mind, a stable, comfortable, well-working mind is psycho, and the soma is a body. These two can come together to trigger various ailments, and therefore it's important for you to know which ailments have a strong psychosomatic connection. So I'm going to ask you a few quick questions, and I'd like you participants to tick in your own journal that you have or a piece of paper that you have, because this is relevant for you to remember even after this session is over. Whether you said yes to any of the questions that I asked you, then you need to know that anything that I asked you that you said yes to needs immediate attention, because it could be a little ailment here and there, but it has a psychological component to it as well. And why does that happen? When stress is not dealt with for a long period of time, when you are not paying attention to your stress, then the body has to find some other way of telling you, of letting you know, of shaking you up and saying, look, you have stress, do something about it. And that is a psychosomatic ailment. It is the final effect of stress that is showing up in your body to warn you, to alert you, to alarm you that there is a lot of stress and you are not dealing with it. Therefore, it is now becoming detrimental to your health. So that is what psychosomatic ailments are, friends. And I'm going to ask you a few quick questions. Let's see how you respond to this. So my first question here is, do you have headaches? I don't mean the headache that you get once in a while. I mean a repetitive headache. Paracetamol, Tylenol, all of these have become your friends because you need to consume them. You need to stop them on a regular basis. So do you have headaches? Whatever be the kind of headaches, Do you have headaches? My number 2 question. Do you have respiratory ailments, which means frequent cough, cold, asthma, etc., etc.? Do you have respiratory ailments? If you say yes, please write down respiratory ailments in your piece of paper because you need to remember and you need to work on this hereafter. Number 3, do you have allergies? And I will explain this a little bit because I don't think enough is understood about allergies, but more and more people are beginning to suffer from allergies for sure. So, for instance, do you have rashes on your skin or hay fever maybe or hives maybe? Does your skin show signs of some irritability, let's say, so that is skin related allergies. You could even have food related allergies. For instance, peanuts don't suit some people. Wheat flour does not suit some people. Milk does not suit some people. Um, Shelled fish does not suit some people to the point where they can get an inflammation in their throat and they are unable to breathe either from their nose or their mouth. So allergies of various kinds, while they may look only food related or only pollen related, could have a strong stress correlation as well. So that was number 3. Number 4, do you have frequent aches and pains in various joints and muscle groups? So it could be a low back pain, it could be a pain literally in your neck. Your shoulders could feel like as if they're really being burdened down. All of these are musculoskeletal symptoms. Again, a big psychosomatic ailment area. The next one is anything to do with your heart. Do you have any cardiac related ailments? Even if you are managing it well, but the indication is that if you have a heart related ailment, the heart and stress and personality are very strongly correlated, friends. So bear that in mind. 3, 4, 5, 6. 6 is 3 ailments coming together. One is blood pressure, the other is high lipids, and the third is high blood sugar. That means diabetes. Do you have any of these 3? I think you have already said yes to one. So if you have any one of these, please write that factor down because that factor is strongly triggered and exacerbated. Again, not caused, but triggered and exacerbated by your stress. Friends, also remember, if you have high cholesterol, for example, and that is not caused by stress but aggravated by stress, but having cholesterol when you perform any activity that is a stressful activity, you will tend to increase your cholesterol while you are performing an activity that you perceive as a stressful activity. So it's important for you to remember that not only does it trigger you to get it, but it keeps on getting triggered with every stress, increasing your sugar levels, increasing your cholesterol levels, and so on. So you really have no choice but to take care of it. When it comes to the women in the audience, do you have menstrual related aches and pains? It could be pre, and for a small group of people, it could be post as well. But majorly, let's talk about premenstrual syndrome. There could be some people who routinely have aches and pains, discomfort, mental discomfort, all of this prior to their periods. And I'm not talking only about abdominal cramps that accompany your periods. I'm talking about a few days before that. If you have a lot of difficulties, particularly psychological difficulties related to periods, it's like an early warning that, okay, in the next 3 days, you are very likely going to get your periods. If this is something that you go through, then this is a psychosomatic ailment that you are looking at. One very large and big area is GI or stomach related ailments. If you have stomach related ailments, remember in the previous slide, we spoke about how you feel hollow in the stomach when you have a lot of stress. So stomach related ailments are also highly psychosomatic. So bear that in mind. And one more thing that I'd like to add is sleep. If you feel that you are not able to go to sleep, or if you feel that you wake up several times in the night and don't wake up feeling refreshed, or you may feel that you wake up early in the morning and then you're not able to go back to sleep, and the final result is through the day, you don't feel very productive because you don't feel rested and refreshed enough. If you said yes, friends, to any of these ailments that I spoke to you about, please understand that your body is giving you very strong signals that there is stress, and that stress is now triggering and aggravating all the psychosomatic ailments that I have spoken to you about. Take note, take action, and start that consistent journey of reversal, because when you start it, you will be closer towards getting that reversal in your life. Next, please. Next, please. Yeah. So the first response to stress is by triggering the autonomic nervous system. What does the autonomic nervous system do? It raises your heart rate. It gives you some palpitations sometimes. It causes your throat to get dry. So these are all autonomic nervous system related changes. And this is the body's first response when you experience stress. But remember, a close second is the endocrine system, and this is where your diabetes comes in. So the endocrine system gets triggered because the endocrine system triggers a lot of very, very important hormones like cortisol, like adrenaline, and all these have a significant role to play in managing stress, but they also have a very significant role to play in diabetes. That is how these two get connected. Friends, when you have stress, the body is basically thinking that I need extra energy to deal with this extra stressful situation. From where am I going to get this extra energy? The only place from where the body can get itself extra energy is through glucose. And therefore, more glucose is secreted in the blood. That by itself is not enough. More oxygen is required as well to trigger and continue this whole process. And therefore, we tend to feel breathless, we tend to breathe longer and deeper, and more oxygen is supplied along with this sugar to every part of our body, particularly our muscle groups. Now you have muscle groups with extra oxygen and extra sugar in all parts, creating muscle tension, getting your body ready for action. But in modern day stress, there is no action required because your stress is almost always mental. Then where does this sugar go? Where does this oxygen and sugar heavy blood that is being supplied to every part of the body, what happens to it? It becomes difficult for the body to deal with this, particularly if you are a diabetic. Under normal circumstances, the body manages to deal with it. If you exercise, you create a big helping mechanism by which you deal with all of this. The extra sugar that has been triggered and generated in your body and is just sitting over there because there is no physical activity and therefore there is no utilization. If you exercise, you actually utilize this and burn it. But the body will find its ways of doing that. But if you are a diabetic, then this becomes the beginning of a big struggle for you. So the second system that gets involved is endocrine system. I explained to you about the sugar being secreted. And the final system that gets involved when you have stress and repeated stress is the immune system. If your stress is immediate in nature, then it will be the autonomic nervous system. If your stress has been staying for a while and you are not dealing with it, it will surely pull in the endocrine system, friends. And if you still have not been dealing with that stress and it has been going on and on and on, there are many areas of stress for a longer period of time, coming about frequently. If all of this is the nature of the life that you're going through, then even your immune system will get triggered in, and then you're exposing yourself to many, many different situations. Currently, you are sitting in the second step, that is endocrine. Take a look. It is reversible, but it is reversible when you work hard towards it, friends. Next, please. How do you cope? Look at the pictures that you have over here. The picture on top, does that describe you? Are you harassed, harried, exacerbated, irritated in life? How am I going to deal with all the stress that life has put in store for me? Why was I the unlucky one? Why is it that I am being tortured so much? Everybody else seems to have a good life. Is that your response to stress? Or is your response to stress that whatever it may be, I definitely do need to deal with it? Depending upon what your decision is, your journey will go as per your decision. If your decision is the picture on top, then that will be your journey, friends. And that does not take you to reversal. But if your journey is the picture at the bottom, where you decide, I have to deal with it, I have to balance it, I have to manage it. If that is your decision, then that is the journey starting off towards reversal, friends. Next, please. Let's talk a little bit about a decision that you could have made. That was the first slide, and that is burnout. Remember that stress is the middle point in all of what you're looking at over here. So there is good stress and there is bad stress. Depending on the decision you make, that is where your journey starts. Let me give you a small little story to explain over here about overload and burnout. So there was this oyster sitting on the floor of the ocean. That's where its home was. And its environment was a lot of sand, a lot of grainy particles, and a lot of salt water in the seabed. This is what the oyster grew up with. But the oyster had a hard shell body, and inside was a soft membranous tissue body. And in order to take in the nutrients from the seawater, the oyster had to open its hard shell body. And in the process of taking in the nutrition, a few particles of sand would also trickle in along with the seawater. This was the daily life of an oyster. Now, there was one oyster who was continuing this process of taking nutrition, but also taking a particle of sand in. And now this particle of sand started irritating the oyster. He started feeling, sorry, no gender, he or she started feeling irritated, harassed. How can I deal with this life? What is wrong with this life? I mean, I'm getting really exacerbated. I'm fed up of this, etc., etc. And that oyster spent the rest of its life in irritation, harassment, and stress. Came along another oyster, and that oyster said, well, here is a particle of sand. It is surely irritating me, but this is where I live, and I am going to have to deal with these particles of sand on a daily basis. I don't have a choice. I can break my head on the wall, beat my head on the wall. The wall is not going to break. And therefore, I have to find a way to deal with this particle of sand. And thinking thus, the oyster then started its journey of finding ways to deal with this particle of sand. And what did it do? It said, let me make this particle of sand less irritating to my soft tissue body. And so it secreted a substance to coat the grain of sand. And with every passing day, it kept on secreting that substance to keep on coating and recoating that grain of sand until finally the second oyster had produced a thing of beauty. And that was a pearl. Now you can be the first oyster that spends its life in harassment, or you can be the second oyster that spends its life creating a thing of beauty while you also take care of yourself. Friends, the decision is yours. Are you going to move towards burnout, or are you going to move towards glow up? Are you going to live your life in irritation, or are you going to live your life glowing and creating beauty? The decision is yours. Based on your decision, your path will unfold itself in front of you. You could be coping through overload and burnout and experiencing that on a daily basis. That could be your coping style. Become aware of what are the effects of your coping style, friends. Next, please. Personality is a major factor in stress. We think that our stress is caused by the environment around us and the people around us. Yes, it's not untrue, but the bigger factor is the personality that you carry with you everywhere you go, even to sleep. You carry your personality with you. Now, while I would usually talk about type A personality and so on, we have less time, and I want to give you some quick thoughts and information, something that can very quickly, something that you can very quickly relate to. So let me talk a little bit about your personality. Are you the kind of person who can only perform when there is stress? For instance, you have a deadline of 30 days. and you keep taking it easy, and you really start performing in the last 3, 4, 5 days. If you don't feel stress, you don't feel productive. You have become an adrenaline junkie. Is that who you are? Is that what your personality is? Another type of personality. You have a team that you are leading, but now you feel a compelling need to constantly keep on correcting your team. You're correcting them, constantly telling them, do this, do that, don't do this, don't do that. So there is a constant control from your side as far as your team is concerned. And then it could be your family, your friends, and so on. Let's look at another factor. You want things to be perfect, whether it is the furniture in your house, or whether it is the files on your table, or whether it is the way in which your coffee cup is kept on the table. You want things to be exactly how you want them to be. And you are a little bit of a perfectionist. Do you identify that in yourself? If you have said yes to any one of the three things that I've spoken to you about, then that is a personality that will give you good results. But it will give you as well as your team a whole lot of stress, friends. So personality is a very big factor in what is causing you a lot of stress. And then the change in that could cause you more relaxation, more comfort, more reversal of stress, and also more reversal of diabetes. Next, please. If you look at a few countries around the world, they must be triggering a lot of sugar in their body. They must definitely be going through pre-diabetes for sure, if not more than that, because they are going through a lot of stress, friends. And while we can sit here and talk about it in our armchairs, life in those countries cannot be comfortable, whichever side of the border you are. Whether you are in Russia, whether you are in Ukraine, whether you are in Iran, or whether you are in Israel, it doesn't really matter. The people in those countries must be going through a whole lot of stress, and for sure, a whole lot of psychosomatic ailments. Just to bring to your understanding that countries also go through conflicts, just as relationships go through conflicts, family members go through conflicts, and friends go through conflicts. If the mentality is that one person must win, then ultimately you're moving towards a win-lose situation. And in the long term, a win-lose situation is unsustainable, friends. You must understand this. A win-lose situation is unsustainable. That person who loses today will wait for an opportunity to win tomorrow, day after, and day after. The only situation that is sustainable is a win-win situation. It requires harder work, but that is what must be a long-term permanent situation that people strive for, relationships strive for, countries strive for, whoever are the group of people. And one thing that becomes essential if you're looking at conflict management, friends, is to communicate, communicate, and communicate, because the beginning of conflict starts with a lack of communication or difficult communication. And so therefore, if you want to resolve a conflict, you have to communicate, communicate, and communicate more. Next, please. I'm going to try and quickly go through the next 2-3 slides so that Dr. Wilku can ask a few questions. Dr. Wilku, is that okay? I see that I have already overshot my time. You have moved out of the slides. Can you please go back to the slide I was talking about? Yes. Yes, please. Dr. Wilku, are you okay with a few more minutes?
Yes, ma'am.
Yeah, ma'am.
We're okay.
10 minutes you can take it, then 5 minutes we will wrap up the questions. No problem.
Fine, fine, fine. Let's talk about sleep, friends. How many hours of sleep do you get? Is it less than 6 hours? Is it less than 6 hours on a routine basis? I would like, if you want to manage your stress and you also want to manage your diabetes, I would like that you get at least 8 hours of sleep. 8 hours of sleep is good. Now, you'll find a lot of reading that says that many of these very major leaders of the world slept only for 4 hours. Friends, remember, most of them had a short life. So let's not use them as best examples when it comes to sleep and management of sleep. So sleep is good if you wake up feeling rested. That's a simple way of looking at sleep. And sleep is good if you give yourself 8 hours of sleep. If you are on a lot of medication, I would like you to give yourself more sleep. If you exercise at least 1 hour a day, I would like you to give yourself a little extra sleep. So 8 hours is something that you must get, friends, because it is in sleep that the body goes into recovery and healing mode. When you sleep and when you are in your deep sleep, that is when all the biorhythms of the body, your blood pressure, your heart rate, the sedentary metabolism, all of these go to their lowest level. All of these go to their lowest level. And it is in that time that there is a lot of extra energy available for the body. This extra energy is then diverted towards healing and repair of the body. So this is something that we need to provide to our system, to our human system, sleep, and therefore rest and recovery of the body. Not enough was understood earlier. Medication was thought to be the biggest healer of the body. It is now more and more being understood by medical science that sleep, in fact, is body's internal way of creating medication that is taking care of itself. Next, please. When we spoke about medication, we also need to talk about meditation. What is it that meditation does? Meditation brings you to a state of calmness. It could be meditation or any relaxation activity, friends, but it brings you to a state of calmness, which means all your biorhythms, your heart rate starts going down. So your normal heart rate should be 72 beats a minute, but most times when you're in a state of stress, your heart rate is very likely 90 or 90 plus. You need to bring that down and you need to keep it down. One of the things that is definitely going to help you, a big deal, is meditation. So meditation will help you to bring your heart rate down. It will help you to bring your palpitations down. It will help you to bring your blood pressure down. It will help you to bring all the triggers that are being triggered as a result of the stress. And therefore, your sugar levels and everything else will respond positively if you are in a state of meditation. 30 minutes a day is what I'm talking about. 30 minutes a day is not too much, but the returns of that 30 minutes is tremendous. So please take a look at meditation and see how you can bring it into your life on a day-to-day basis. Friends, the second part of meditation that not enough is spoken about is detachment, a way of managing yourself, your life, and your relationships where you are attached to people, you are attached to your work, you are attached to your ambitions and goals, but you're attached in a detached way, which means you don't kill and slaughter yourself if you are not able to be successful in something. You have the energy to get up, pick yourself up, dust your clothes, and get back to a next day. You are attached, but in a detached way. Think a little bit more about this. This is something that Buddha spoke a lot about. But aside from that, be attached. It will help you in your achievement and productivity. But be attached in a detached way because you will detach from the stress that will come from struggling in some areas. So that is another part that you will achieve if there is meditation in your life. Next, please. Next, please. Next, please. Yeah. I'm going to end with this slide, friends. Take a quick look at the factors that I have written over here. On the left are many factors, on the right are many factors. Don't look at, is left important, is right. I ask you a simple question. Look at all the factors and pick up those factors that you can control and pick up separately in another list those factors that you have very limited control over. For instance, let me ask you, can I control my past? And I think you know that your answer is no. I cannot control my past. It's gone. It's finished. It is in the past. And therefore, I have zero control over my past. So then past is not an I factor, past becomes a they factor. Let me talk about action. Is action in my control? In fact, action is probably the only thing in my control, and therefore action becomes an I factor. So take a quick look at these factors over here, friends. Take a quick look and write down what is an I factor, what is in your control. Take a quick look. I'm going to just give you a moment because I don't have time. Just take a quick look, friends. This is an exercise for you to write down. Please write down those factors that are I factors, which means they are in your control. Friends, you have some factors over there. Think about it. Ponder over it. I will ask you one question over here. Where would you put diabetes? Would you put diabetes in I factors, or would you put diabetes in they factors? Do you control it? Can you control it? Or is it beyond your control? Think about it and take a decision. Next, please. Basically, I factors are something that are in your control. They factors is something that is in either nobody's control or in other people's control, but not in your control. So what can we do? Worry about the factors that are not in our control? No, let's focus on the factors that are in our control, and let's focus and work on those factors. And friends, I started by saying this to you, and I want to close by saying this to you. Diabetes and stress both are factors that are in our control. Whether it is in a small way or in a major way, it is in your control. Think about it, start to manage it, keep a few of the thoughts that we have spoken about in mind, and you will be able to get on the journey of reversing type 2 diabetes and also reversing your stress. Next, please. Thank you, friends. If you have any questions, I'll be happy to answer them.
Dr. Savita, thank you. Thank you. You're more than accomplished, as some of our listeners have mentioned. You have more than accomplished your star position. Thank you so much. Thank you so much. And I have discovered, Dr. Savita, I have discovered that diabetes is an I factor. I can control it. That is my learning. And that is a profound learning from today's talk. Diabetes is an I factor. I can control it. And if this message, and it is your message, if this message goes to all our diabetes colleagues, and we will make sure that it does, we will blazon it on top. Diabetes is an I factor. I can control it. And we will take it forward. Thank you so much. I will now leave you with Dr. Wilku to ask a few questions, as he always does. Dr. W, sir.
Yeah, thank you, sir. First of all, thank you, Dr. Savita, for a wonderful session. Really, it was very interesting. So, and as the things are interesting, there will be more queries also. Even I have, but I will take the questions from the participants first. First, you have mentioned about the anxiety, stress, and how it is correlated with the controllable things and achievable things, and which are not under the control. So, first question, Orhan has asked, my sister is on antidepressant medicines. Will it risk diabetes?
If you are managing your depression, if you're really working hard towards managing your depression, then yes, you need to keep in mind that it is a risk factor, it is a trigger factor. However, if you are in a management path, then you are going to deal with it. If you are just in a path where you throw your hands up and say, what can I do? Alas, then that is not a managing plan, and then the depression will make it difficult for you. The diabetes will make life difficult for you as well. And friends, medication is a very good management plan, but along with medication, there has to be therapy as part of your management plan as well. Reason being, that medication helps you to manage those situations and bring you up to a certain level where depression does not give you any strength and energy, any motivation. But you also need to correct some of your thinking patterns, which will come through therapy. So you need a combination of both to manage your depression, and you need a lot of, I won't say therapy, but psychology and understanding of the functioning of your mind and personality to manage your diabetes and start the process of reversal as well. So if you are in
Yeah.
action mode, then it will be good for you.
Yeah, medication is always tertiary management, but we must focus on the primary to manage it. So that's a good one. And Advik has asked, I recently found, even this was, I was thinking about the same thing. I recently found to have elevated glucose levels without having any family history or medical history. I do exercise daily and have balanced food. Is my elevated sugar due to stress? I work in corporate finance department. Corporate
Edwin,
finance, already
Edwin,
stressful.
you said Edwin, the gentleman?
Yeah, Edwick.
Okay.
Edwick.
Edwick, remember what I said in the beginning, stress is not a causative factor. So I will not say that your stress has caused you. You need to do a thorough analysis. You need to talk to your doctor. But I will say that stress is a close second when it comes to an aggravating factor. So there are other factors that have caused you this. I cannot give you a quick answer on the first, which is what are the causative factors. But I can tell you for sure that stress is a close second, which means it is aggravating your sugar levels. It is triggering your sugar levels. It may have decided the timing of when the sugar levels became high in you. And remember, when you experience stress, there is an immediate sugar response because that is the energy that you need to deal with that stress. Our ancestors' stress was physical in nature. They needed physical energy, and therefore sugar was secreted in your blood. So the relationship of sugar and stress starts from that point where you see stress as a monster standing in front of your house and you have to run, either run away or run towards or whatever that might be. The relationship of sugar and stress starts from that very beginning, but it's a normal, healthy response. It only becomes normal and not healthy if you have issues with sugar. So ask yourself the second question, is stress aggravating my sugar levels? Yes, it is definitely aggravating your sugar levels. It is not causing it, but it is aggravating.
Yeah, thank you, Doc. There is one interesting question. See, everyone now after this session, those who have attended may be anxious about how it happens and what is the triggering factor behind it. Dr. Poonam is asking the similar question. Can restricting calories intake with the fear of spiking sugar good for managing diabetes? Is again an indirect question for the stress relation.
Do not take any unhealthy steps. Do not, deprive yourself of food. Give yourself healthy food that a diabetic is allowed and is good for diabetes. So depriving yourself of food is not an answer. Okay. Healthy food is an answer. And friends, I will say that there is one answer that I'm sure has been covered by other experts, but I am going to underline it over here. One of the biggest and best managements of stress, and it also happens to be one of the biggest and best managements of diabetes. Can you tell me which factor that is? And that is exercise. So friends, whatever may have caused you stress, whatever may have caused you diabetes, but if you make exercise a part of your daily life, and I will say that if you have a combination of stress and you have a combination of diabetes, do you have a choice? You don't have a choice. You need to give yourself 30 to 60 minutes of exercise on a daily basis, and you will find the wonderful changes that your life will start showing to you when you just bring in this management technique on a daily basis. So to Dr. Poonam, I will say, I would rather that you look at exercise than, sugar spikes and food and all of that.
Yeah, thank you, ma'am. Ma'am, nowadays in the internet you will find many information regarding how to manage stress, meditations. So Parampreet has asked this good question. What is the correct way to meditate? And is there any specific link or you will suggest for meditation sessions?
Parampreet, our forefathers and ancestors did not need meditation rather. They didn't get medication either, but that's another matter. They did not need meditation, but that's because their life did not have the kind of stress that we have. Today, we are stressing about social media. Can you think our ancestors would ever stress on that? So, therefore, we have overloaded our lives with a lot of stress. And because of that, sleep is not enough as a management tool. If sleep is good, then it is one of the best tools in managing stress. It will help greatly in managing diabetes also, and people should try this. Enough studies have been done, just read up a little more on it. I didn't have enough time, so I'm not able to quote studies and so on. But sleep is wonderful, but in our current modern life, sleep is often not enough, and that is where meditation comes in. Now, I'm going to be very simplistic and say, let's not complicate our lives, whether it should be Vipassana, should it be Hatha Yoga, whatever it should be. If you can sit in a comfortable position with your back straight and you close your eyes, keep the room quiet, keep the room not too brightly lit, keep the room with no disturbance, and you just start to breathe calm. Just focus on your breath and breathe calm. Make slow inhalations and make longer and slower exhalations. It is as simple as that. If you start only with that, you are already on the journey of meditation. Once you're on the journey and you spent a year, two, whatever, then you get on the journey of finding more elaborate methods. Should it be transcendental meditation? Should it be Vipassana? Answer those questions later. Don't worry about it in the beginning. Start with the journey of calming your breath. The breath is the essence of any meditation. You start the journey of managing your breath, you will already be on the journey of meditation.
Yeah, true. And you mentioned about the social media stress. Recently, 2 months back, I have posted one blog for popcorn syndrome, which is now most of us are suffering with. There is one another question Alam has asked, but this is not related to the topic we are discussing today. He had pain in the shoulder and hands. His uric acid is high. No problem, Alam. I will get your answers posted to you directly. So from my side, there are, okay, my questions are finished. But ma'am, I will personally ask one question. Yeah, focus on exercise. Okay. My personal view, whatever we sat on the session and we learned many things. And just now you answered for the breathing technique. So my question is, when you suggest for a breathing technique to meditate, to relax, to calm yourself, and what time is the best to do this breathing technique? Post exercise means doing after exercise, the breathing techniques is more efficient, or whenever we get time without doing any exercise, we can do the breathing technique to meditate.
Important to do it not full stomach. So don't do it immediately after food. All the energy that your body has is diverted towards digestion. And so therefore leave the body alone as much as possible post your meals. Don't make your body do any other activity during that period. So therefore I will say post meals, leave your body alone. Do you know that in China, there is a practice of giving everybody 30 minutes of break after meals? They actually pull their beds out or their reclining chairs out and they take a nap. That important is post-meal relaxation. Doesn't have to be sleep, but it is relaxation. Call it a cat nap and so on. But relaxation, meditation, sleep, that important it is. We have started neglecting it. But what I will say is that after exercise, in fact, your body is already wanting relaxation, and therefore it's a good time to do a simple breathing exercise because your body is already a little tired and it will welcome that relaxation. So you'll feel good. You'll feel even better if you do the relaxation post-exercise. Just do not do it post any meals, but beyond that, any time of the day that you have time, you start with your relaxation breathing exercises, whichever you pick up. There is a very simple breathing exercise called Anulom Vilom. It is part of yoga. Any yoga teacher will teach you Anulom Vilom. It is a completely scientific exercise. It keeps your mind occupied, does not allow your mind to wander all the time while you are starting with this exercise. It focuses on the inhale, exhale, and all you need to do is 12 cycles to begin with, which will take you like a minute, minute and a half. And then after mastering it for a while, do it for 24 cycles. So it does not take you too long, but it starts you off on the journey of breathing exercises and relaxation and meditation techniques.
Yeah, this was my second question. You have already covered the answer with that. What was the best breathing exercise you should prefer? So Anulom Vilom is the answer. Thank you, Dr. Savita,
Sorry,
for a
friends,
wonderful session. Professor, over to you.
Ma'am, you were about to say something.
Yes, I was about to say that the best should always be the easiest. I want to underline this as a psychologist. We try to look for the best and we try to climb Mount Everest. It's not sustainable, friends. Don't do it. You can't climb Mount Everest on a daily basis. You will start, you will also stop. So the best must always be the easiest. Start your journey with what is the easiest. So therefore, start with the easiest relaxation technique. Start with the easiest exercise. What is important is to start and not how strenuous and difficult that activity is. Thanks, Doc.
And
this will be a tagline.
Yeah.
My great privilege to say thank you. Friends, you may not know this, but a few years back, I was in fact Dr. Savita's patient. If that is a sentence we use. A few years back, I went into a panic situation and I couldn't sit in aeroplanes. I couldn't sit in a car. These were confined spaces. I was claustrophobic. And I am an international traveler. So it made my life very difficult. I met with Dr. Savita and she put me through a series of sessions. And the simplicity of the breathing technique that she gave me, which I still use, allows me now to bring my panic down to a state of complete control. And I can tell you that I am now a silver card member of Emirates, which means that I travel in that aeroplane almost every week. And I sit in my car every day and travel to work. Now, that is a personal thank you to Dr. Savita. And I would like to thank Dr. Savita on all our behalves for that extremely inspiring session where she brought in the simple factor of I can control my diabetes. Thank you very much, ma'am, and God bless you. Thank you so much. Dr. Wilku, thank you, sir, for your ever persistent questions and for creating everything that makes this webinar possible. As a matter of fact, I must tell you, it was Dr. Wilku who approached me and said, can we get Dr. Savita? And I said, I will do my best, and I'm glad I succeeded. I want to thank you, Dr. Wilku. Team AWRM, my dear friends out there, I know that Saloni is not well. I'm so grateful for you to have come on and managed whatever you needed to manage, the starting and the stopping and the recording and things like that. Thank you very much. Friends, our next seminar is on Friday, the 25th October, where we will talk about heart health. And with that, I would like to say goodbye, good day, and thank you once more. There it is on the site, the webinar on diabetes and heart health on the 25th of October. Thank you very much all, especially Dr. Savita and Dr. Wilku, and good day.